Hi, my name is Andy Imparato, and I am the Executive Director of Disability Rights California. I can think back to a lot of different interactions I had with people with disabilities growing up, but I would say the thing that had the biggest impact on me was as I was starting my career as a lawyer, I ended up getting diagnosed with bipolar disorder. And I was working in an organization that was advocating for the rights of people with disabilities. And I learned the idea that shows up in a lot of federal disability laws, the idea that disability is a natural part of the human experience. And I found that statement to be very powerful as I was trying to deal with a new diagnosis of bipolar disorder. I think the message I was getting from the mental health world was that my diagnosis was not natural, that it was kind of a long-term problem that I was going to have to address. And I didn't get any sense that the experience of living with bipolar disorder could actually benefit me and could actually help me in my career. And what I got from being around disability rights advocates, people with lived experience with lots of different kinds of disabilities. I was living in Boston at the time, was the idea that my lived experience was actually a strength and a source of credibility for the work that I was doing. And that if I wanted to be effective as a disability advocate, I needed to learn to see my disability as an asset and as a strength. So, I kind of feel like the Americans with Disabilities Act is reflecting the values of the disability rights movement. And one of those most important values is the idea that disability is natural. Your life with a disability is a natural part of the human experience, and that it should not prevent you from doing anything that you want to do. And when you are prevented from doing those things, it's discrimination, it's not natural. The idea that discrimination is unnatural and disabilities are natural, that was a powerful thing for me, and it helped frame my experience as a person with a long-term disability that I acquired as an adult. The most important thing that the disability movement got from the Americans with Disabilities Act was the framing of disability issues as civil rights issues. If you look at kind of the history of disability policy in the United States and in other countries, people often saw disability through a social welfare frame, through a poverty frame, through a kind of the worthy poor frame. And the idea was if you want to address the problems that people with disabilities have, you just need to provide the right services. But there wasn't a concept of discrimination. There wasn't a concept of human and civil rights around that. We had earlier laws like the Rehabilitation Act that had a piece of the law that tried to deal with disability discrimination. But the ADA was the first law where the whole law was really about addressing discrimination. And I think for a lot of us who live with disabilities, the civil rights frame is a very empowering frame because it stops, if something bad happens to you as a person with a disability, it stops being about what did you do wrong, or what services do you need to avoid doing that again. And it starts being around, well, maybe the system was designed to exclude you, and that's discrimination. So don't just look at the person as the source of the problem, but look at the environment. And that concept, I think, has been a really important concept to help us reframe why bad things happen to people with disabilities, why exclusion happens, why segregation happens, why poverty happens. And it helps us have higher expectations for ourselves and higher expectations for the environment around us. So there are a lot of very concrete things that the ADA has done, like make the buses dramatically more accessible for people with a wide range of disabilities, make the kind of built environment dramatically more accessible. But I think almost like spiritually, framing our issues as civil rights issues, as justice issues, as human rights issues, I think that was as important as any specific requirements in the law. It's hard to pick one issue that would be the big thing that I would like to see change moving forward as we think about the next 30 years of the Americans with Disabilities Act. But I will say one thing that I think is critical for us to change is what we require people to prove in order to get support from the government through our largest program. So if you look at our four biggest programs that serve people with disabilities, Social Security disability insurance, supplemental security income, Medicaid, and Medicare, those programs require you to prove that you have a disability. And the way you prove that is with medical evidence that shows that you, because of your physical or mental disability, you're unable to engage in substantial gainful activity. Most people understand that to mean that because of their disability, they can't work. And that frame for trying to decide who deserved to have support from the government, that frame dates back to 1956. That's when that definition was written in the federal statute originally. And our thinking about what's possible for people with disabilities to achieve in the labor market has evolved hugely since 1956. We know that people with very significant disabilities can achieve success in the competitive labor market if they have the right supports. And but yet we still require people to produce medical evidence that their disability prevents them from working in order to get supports that they need to live independently and to work. And it's just a backward system. You know, we've tried over the years to build work incentives into the Social Security disability programs. We've got a Medicaid buy-in program. We've done a lot of things on the margins to try to make it easier for people with disabilities to work and get benefits, but we haven't dealt with that fundamental definition of who's eligible for benefits. So one of the things that I'm hoping to see as we move forward is to align the definition of disability in the Social Security and in the disability benefits laws with the vision of disability in the Americans with Disabilities Act. Instead of asking people to prove that their disability prevents them from engaging in substantial gainful activity, we should be asking them, what supports do they need to be able to participate fully in the community? And we can decide if you need a certain level of support, then you're eligible for income supports. It could be a whole other thing for healthcare or other long-term services and supports. But under no circumstance should we require an 18-year-old who's just starting out as an adult to produce medical evidence that their disability prevents them from working. And that is our policy. It's been our policy since 1956. And we spend hundreds of billions of federal dollars through programs that require people to make that initial showing. So I feel like that's a very important thing for us to change if we really want to realize the vision of the Americans with Disabilities Act. We've been thinking a lot at Disability Rights California about how can we respond to the three crises that are playing out in our state and around the country. One is the pandemic. Another is the economic downturn that's connected to the pandemic with lots of people losing their jobs. And then the third is this national conversation that we're having around racial justice. The pandemic disproportionately affects communities of color in California. The economic downturn disproportionately affects communities of color, and police violence and all of these structural barriers which exist in every program that serves children and adults with disabilities, again, disproportionately affect in a negative way Black children and adults, Latinx children and adults, and others from diverse communities in California. So when we think about a call to action, I feel like one of the most important things we can do as we celebrate the 30th anniversary of the ADA is really shine a spotlight on which populations in California and around the country have had the least positive benefit from the Americans with Disabilities Act, and what can we do to extend the vision and impact of that law to communities that have not felt the impact to the same degree as middle-class families who I think have been the primary beneficiaries of the law. So what does that mean? It means in the school system, doing more to not have disproportionate discipline fall on children of color with disabilities. Trying to get police out of the schools, to me, is part of that conversation. In our regional center system across California, addressing the disparities so that families from low-income backgrounds, diverse families, have the same access to services and supports as wealthier families. In the context of the vocational rehabilitation system, again, applying an equity analysis and making sure that the population served by that system looks like the population of California. And I feel like this is a national conversation, but California can be a leader in the country because we are a leader in so many other ways. We are one of the most diverse states in the country. We have a progressive state government that cares about diversity, that cares about inclusion, that cares about equity. We have a governor who created a task force to rebuild the economy and included my predecessor, Catherine Blakemore, the former executive director of Disability Rights California, on that task force, along with the CEO of Apple. We have the tech industry, which is kind of changing the world literally in terms of how people interact with the world. And there's a huge opportunity for us to make sure that people with disabilities from diverse backgrounds have opportunities to work in the technology industry and to shape the technology that we're all going to be using day to day in the future. So I feel like one of the most important messages for this anniversary is let's make sure the vision of the ADA reaches all of the populations who could benefit from it. Let's address structural racism, let's address disparities, let's address inequities that exist in every system that serves people with disabilities, so that the vision, the inclusive, the radical inclusive vision of the Americans with Disabilities Act is one that can be experienced and that our whole community can benefit from.